Okay, so today I want to talk about what makes someone a great candidate for migraine surgery. There is a cure, there's a potential cure. I've been doing migraine surgery now for almost 15 years, and in that time, 80% of our patients have had an incredible change in how they feel their symptoms. A significant number of patients have an improvement in the number of headaches that they have per month and also the magnitude of the headaches. So if I can decrease the magnitude, if I can take it from a 10 to a 3, and instead of having a headache every other day to maybe having it 2 or 3 times a month, there is this ability to do surgery and decompress the nerves. So what I ask you to please seek a board-certified surgeon who does migraine surgery, and then connect them with your doctor and your neurologist. Have a robust discussion about how we can help you through various aspects, but it doesn't happen until you really go and seek this out yourself. All right, just don't be relying on the old school way of I just got to take pain pills and deal with it. So to understand the thought process of what I'm discussing, please go to our website, cosmoplastic.com, and I'll be happy to answer any more questions that you have.